Have you been taking your thyroid pill faithfully every single morning, but you're still feeling tired, you're still feeling foggy, and you're dragging throughout the day? And also, you might be seeing the scale creep up a little bit, which was the opposite of what you were told was going to happen. You are not crazy, and you definitely are not alone. The truth is that sometimes it's not you. Sometimes it's specifically how that medication is being taken, what's interacting with that medication, or even specifically which thyroid medication you are prescribed. And to add to that, if you have not heard, the FDA is actually pulling Armour Thyroid from the market. And yes, that is real. So we need to talk about what that might mean for you if you are someone taking Armour Thyroid, because a lot of people are going to be switched to something else, whether they like it or not. If you are new to my channel, my name is Takova Wallace-Gay. I am a clinical pharmacist, a wife, a mom of two littles. And what I do here on this channel is very simple. I help you make sense of your medications because let's be for real. Most people do not understand the pills that they are taking. They don't know why they're taking it. They don't know how to take them the right way. And they just don't know if it's safe or not. And that's where I step in. I call myself the community's pharmacist, and my mission is to help you feel confident, gain clarity, and gain control when it comes to your medications. So let's start specifically today with these thyroid medications. The problem with thyroid medications is that so many people are on them, they're taking them correctly, but they still feel that the medication has failed them. They're doing what they're told to do. Nothing is changing. The scale is not changing. The symptoms are not changing. And that's frustrating. That leads people to skip doses. And some people even stop taking the medication altogether, which ends up having a long-term hit on your overall health and also leads to long-term reduction in energy, long-term brain fog, hair loss, mood swings, all of those things. So I really want you to stop guessing and hopefully start to understand a little bit more what's happening with this thyroid medication and also what your options are, including what's going on with Armour Thyroid if that's something that interests you. So let's talk about the main medication that's prescribed for hypothyroidism, and that is levothyroxine. It is the most common thyroid medication prescribed, and this one specifically replaces T4, which is a hormone that your thyroid would normally make. The problem is it only works if your body can actually absorb it and convert it into T3, which is another hormone that your thyroid normally makes. So with levothyroxine, if you take it with food, your body is not going to absorb it. If you take it with your morning coffee, the caffeine in that coffee is going to block it. If you take it with vitamins like iron or calcium, so your multivitamin in the morning, for example, those specific vitamins are going to bind to the levothyroxine and basically carry it right out of your body. So you don't even get any benefit from it. So you're swallowing the pill, you're taking it like you're supposed to, but your body is not really getting it. And one pearl I want to add here is if you are chasing your thyroid pill with that gummy vitamin or with your cup of coffee, you have basically wasted that dose. And also, if you are concerned specifically about absorption, or if you want to try to get around some of those things, like you always want to drink your coffee in the morning or whatever it may be, you do have a couple of options. You could also crush the tablet and put it under your tongue and then just let it sit there to dissolve. Maybe drink a little bit of water, but really let the saliva in your mouth help it dissolve. And that way it goes straight into your system through the mouth, and it does not have to worry about going through the gut at all. So we reduce a little bit of worry about that issue of absorption. Also, you can take levothyroxine at night. I know oftentimes when we recommend levothyroxine, we say take it in the morning on an empty stomach, all of those things. But you could also take it at night. And there is some data out there that shows that it works really well if taken at night. And specifically, you still need to be somewhat on an empty stomach. So if you aren't eating within 2 hours of bedtime, I think, a couple of hours after you eat, but right before you go to bed, take your levothyroxine. And levothyroxine specifically doesn't peak in your system for about 2 to 4 hours. So after you take it at bedtime, let's just say you take it at 8 o'clock, around 10, 11, 12 o'clock is when those levels are going to start to peak. And you should be asleep then. There shouldn't be any outside factors affecting the medication from doing its job. So those are a couple of ways that you can maybe get around some of the issues with fully absorbing and getting this medication into your system is crushing it, putting it under your tongue. It is not going to taste well. You're not going to like it, but you're going to actually get the medication a little bit more, or you can take it at bedtime and then allow it to do its job overnight. Now, I want to talk about some different medication options because we know that levothyroxine is the most common one, but it is not the only one out there. But just to kind of lump them all together, I'm going to just give a little bit more detail on levothyroxine to start, and then we'll go into the other ones. So, levothyroxine, the brand names for it are Synthroid and Levoxyl, and it comes as a generic, so most people will get it as levothyroxine. But some pros of this are that it is pretty well studied, and because of that, it is our standard of care. So most individuals, if you have hypothyroidism, you are probably on levothyroxine unless you have requested something else or had some other nuances going on and you were given a different option for your hypothyroidism. It also has pretty consistent dosing. So it's dosed once a day. It's very widely available, covered by insurance, so not very expensive. And again, we do have a lot of data to go with it. So that just helps wrap it up into a bow of why we use it very often. But some things to think about with it is some people don't feel well or don't improve on levothyroxine alone, because levothyroxine is just synthetic T4. So it is lab made T4 hormone that we're giving you. And if you recall, I mentioned before that our bodies convert T4 into T3, and T3 is really what we use for all of the energy and metabolic things of the body. So if you take levothyroxine, we still need the body to convert it from T4 to T3. And some people don't do that very well. And also, as I've talked about in the beginning of this video, it's very finicky. It's so sensitive in how you take it. So nothing else needs to be interacting with levothyroxine in order for you to get the full benefits. And you could be in a situation where you've been taking it with your meal or you've been taking it with your vitamin. And because we thought the dose wasn't working, you're telling us you're taking it every day, then you were bumped up on a dose. So I want you to keep in mind that if you do start to take this correctly, just keep an eye on your symptoms to make sure that if you're on a certain dose, now we're not over medicating you. Because once you start taking it appropriately, you may need less of a dose. A second medication that can be used for hypothyroidism is called liothyronine. Excuse me. The brand name for that is Cytomel, and liothyronine specifically is synthetic T3. So why don't we just give everybody liothyronine? Just give them T3. Well, there are some things to consider with it. So it is active T3. That's great because we know that the body is going to convert the T4 to T3 anyway. So in this case, no conversion is needed. And you can give it to people who need a boost of energy. So because we're giving them that T3, it really helps to work pretty quickly versus T4 is going to take a little while. It may take about a week to start to feel some benefits and even up to 6 weeks to feel full benefit. But with T3, you start to see at least that energy boost fairly quickly. But because it does not last in the body very long, you have to take it multiple times a day. And ain't nobody got time for that. Most people don't want to take a medication 2 or 3 times a day. And so you would have to take liothyronine multiple times a day in order to get the dose that you need at the levels that you need throughout the day. Also, because it is just directly giving you the T3 that your body needs to replace, and it's doing so pretty quickly, there is a higher risk of heart palpitations, anxiety, jitteriness, all those things that you feel when you're hyperthyrotic, just because it's easier to overdo it with the T3. So we would definitely want to keep a very close eye on your labs. We also have combination therapies that have both T4 and T3 in them together. These are nice because they do mimic the natural thyroid balance of hormone in the body. Some patients feel a lot better just using the combo, but it is a little bit harder to dose these. The labs are a little bit trickier to interpret, and not everybody feels comfortable in terms of your physicians or prescribers with actually prescribing this medication just because we don't have as much long-standing data on it and we just don't understand as much about how to interpret the labs with it, but it is an option. And then finally, we have our desiccated thyroid extract, and this is our Armour Thyroid or Nature Thyroid. There are a few different brands out there, but this desiccated thyroid is extracted from the thyroid of pigs. Yes, pigs. It is natural and it contains both T4 and T3. Patients love it. People that take it really swear by it. And if you're someone who really wants the natural option, this has been the option for you. The problem with Armour Thyroid is that the hormone levels from batch to batch can vary. This is something that's not approved by the FDA in the same way as the other medications. And so it's really hard to keep track of, even from the same manufacturer. If you get one bottle of medication and then next month you get another bottle, are you getting consistent levels of the hormone from batch to batch? So that just makes it difficult for us to interpret your labs and understand what changes you might need. And the biggest news with it is that Armour Thyroid is now being pulled by the FDA because of that lack of consistency. That lack of consistency from batch to batch leads to a lack of or a concern with safety. The amount of the hormone is so unreliable that one person might have, or one batch, might have too much of a hormone. The next batch might have too little of a hormone like T4. And with your thyroid hormones, with thyroid medications, even really small adjustments or small changes can make a big difference. And so we're just trying to be a little bit more cognizant about that. Some of the companies that make these Armour Thyroid products or these desiccated thyroid products are trying to keep their versions available, but with everything that I've looked up, the reality is that most people that are on these medications are going to be switched, even if it's just for a period of time, because pharmacies and providers are already starting to just move patients off of it so that they can go ahead and be on something that we know is going to be available, or that we're pretty confident is going to be available in the next few months. And Armour Thyroid, the desiccated thyroid products are just likely not going to be available. So if you're on one of these products, now is the time to talk to your provider about what to switch to and how to make that switch appropriately so that you are monitoring your labs very closely during that transition to prevent any very high or very low shifts in your thyroid hormone level as you switch over. So how do you make these thyroids actually work for you and stop them from failing you? Take it on an empty stomach. That can be first thing in the morning with just water, or you can switch to trying to take it at night, a couple of hours after you've had dinner, right before you go to bed. Wait 30 to 60 minutes. If you're taking it in the morning, wait 30 to 60 minutes before having coffee and before having your breakfast. Also, if you want to, you could crush that up, put it under your tongue. It's not going to taste great, but it will absorb directly into your system. Also, make sure to separate vitamins. So if you're taking calcium, iron, if you're taking antacids to keep you from having some reflux, you really need to separate those from your levothyroxine by about 4 hours. That's sometimes difficult to do, so you could try 2 hours and see if you start to see some improvement with that, but you really need to separate it by 4 hours and not take your vitamins until much later. And then also, one thing that I haven't mentioned yet is to stick with one brand or one manufacturer. Levothyroxine specifically is one of those medications that from brand to brand or manufacturer to manufacturer, they all work, but the efficacy or equivalence of how well they work at different doses may vary slightly from brand to brand. So don't let your pharmacy bounce you around from brand to brand. When I worked in community pharmacy, we would often have a person's name on the bottle or on the brand that belonged to them, unless it was a situation where we were getting the same brand for everybody all the time. But make sure that you're sticking with one brand or one manufacturer. And if you want to know which manufacturer you are being dispersed for your medication, you can look on the side of your pill bottle, and usually at the bottom in very small letters, it will say manufacturer, and it'll tell you who that set of pills came from. And then also make sure to get your labs checked regularly. Because we only check the TSH sometimes once a year, or if we make dose adjustments, it can be tricky to make sure that you stay on top of it. But you at least need to have your TSH checked. And in some instances, you may also need your T4 and your T3 checked. So it just depends on what you and your provider have agreed upon, what medication you're taking. But either way, make sure to get it checked regularly. And anytime you have a dose change, if they don't order a TSH, just ask for it. Ask to have your labs checked 4 to 6 weeks after we make that dose change or dose adjustment. And with that 4 to 6 weeks in mind, the reason why is because it will take a little bit of time for the hormone levels to recalibrate, if you will, to that new dose for you to see the full benefits or effects of that change. So just kind of keep that in mind is that you may see some benefit within about a week, 3 to 5 days or so. But in order to see the full benefit, the full effects of that dose or of that dose change, it's probably going to take about a month or so. So track your symptoms right alongside with your labs. Make sure you come in and give us the full story so that we know exactly how you've been feeling and we're able to link that with your labs as well. All right. So that is everything that I feel like you need to know for now about your thyroid medications. I do have a guide that can help you because your medications only work when you understand the details, when you're consistent, and when your healthcare team is paying attention. And it is up to us, it is up to you to make sure that they are consistently paying attention to you like you are their only patient. And that is why I created my medication mind map. It is a free tool. It's going to help you track the specifics of your meds and the information related to them, like your labs, your symptoms, any side effects. And you can see just in this one concept map what medication you're on for what condition, what the dose is, what the best way to take it is, what the side effects you should expect, all of those things all in one place. And it just gives you a big picture so that you don't have to go to your appointments guessing or trying to remember things. And you can really start to connect the dots between each of your medications and each of your medical conditions as you build out your full medication mind map. So there's a free starter template in the description box below. Go ahead and grab that and start to get moving on understanding your medications just a little bit better. Until the next video, thank you for watching and I will see you then.